Picture this: you're young, healthy, and invincible. You feel like nothing can stop you, and life is full of endless possibilities. Life is good, right? Then bam, a sprained ankle sends you to the ER. Suddenly, your carefree days are interrupted by pain and uncertainty. Weeks later, a bill arrives that makes your stomach drop. Thousands of dollars for a simple sprain. You wonder how a minor injury could lead to such a major financial burden. This, my friends, is the reality of the American healthcare system. A system where even the smallest medical issues can lead to overwhelming debt. A system that often feels designed to drain your bank account before it heals your body. It's a harsh reality that many Americans face every day. We're sold on the American dream, but what about the American nightmare of unaffordable healthcare? The dream seems distant when medical bills pile up. It's time to face a harsh truth. The U.S. healthcare system is in crisis. The headlines scream about it, but the real impact is felt in our homes and communities. Millions struggle to afford basic care, while others face crippling medical debt. The system is failing those who need it most. It's a system that breeds frustration, fear, and a desperate need for change. Let's explore why. Let's delve into the complexities and understand the root causes. But don't worry, this isn't a tale of despair. There's hope on the horizon, and together we can find a way forward. We'll navigate the labyrinth of healthcare woes together, uncovering the root causes and exploring potential solutions. We'll look at innovative ideas and success stories. Because knowledge is power, and understanding the problem is the first step towards fixing it. Together, we can make a difference and work towards a better, more affordable healthcare system for all. Let's talk numbers. Did you know that the United States spends more on healthcare than any other developed nation? Yet we lag behind in key health outcomes. It's like paying top dollar for a gourmet meal and getting a stale sandwich. Something's not adding up. One major culprit? The exorbitant cost of healthcare services. From prescription drugs to hospital stays, the prices seem to defy logic. It's enough to make you swear off ever getting sick again. But seriously, the financial burden of healthcare is no laughing matter. It's a weight that crushes families, forcing them to make impossible choices between their health and their financial well-being. Stay tuned as we delve deeper into the human cost of this crisis. In theory, health insurance should be our safety net, protecting us from financial ruin in times of medical need. It promises peace of mind, assuring us that when health crises strike, we won't be left to fend for ourselves financially. But in reality, it often feels like navigating a minefield of confusing plans, denied claims, and mountains of paperwork. The sheer complexity can be overwhelming, leaving many feeling lost and frustrated. Ever tried deciphering an insurance explanation of benefits? It's enough to make you long for the days of hieroglyphics. The language is so convoluted that it often feels like you need a degree just to understand what you're being charged for. The truth is, even with insurance, many Americans face sky-high deductibles and co-pays. These out-of-pocket costs can be crippling, making it difficult for families to manage their finances. It's like having a car with a $5,000 deductible. You might have it, but can you afford to use it? The same goes for health insurance. Having coverage doesn't always mean you can afford the care you need. This leads to people delaying or foregoing necessary care, putting their health at risk. The fear of incurring high medical bills forces many to make tough choices about their health. But wait, there's more. We haven't even touched upon the complexities of pre-existing conditions, out-of-network charges, and the constant battle for coverage. These issues add another layer of stress and confusion. It's enough to make you want to scream into the void or at your insurance company's customer service line. The endless hold times and unhelpful responses only add to the frustration. But don't despair, because coming up, we'll hear from real people grappling with these challenges and discover how their stories are fueling a movement for change. Their experiences highlight the urgent need for reform and inspire hope for a better future. Here's a sobering statistic. Medical debt is the leading cause of bankruptcy in the United States. Think about that for a moment. People losing their homes, their savings, their livelihoods, all because they got sick. It's a heartbreaking reality that underscores the deep flaws in our healthcare system. Imagine this: you're battling a serious illness, fighting for your life, and then the bills start piling up. The stress, the worry, the fear of financial ruin. It's enough to derail even the strongest among us. Have you or someone you know experienced the crushing weight of medical debt? It's a story that resonates with millions of Americans, and it's time we demand better. Join us as we shift gears from the problems to the potential solutions and explore how we can create a healthcare system that puts people before profits. Section 5. Faces of Frustration. Behind the statistics and policy debates are real people, mothers, fathers, children, whose lives have been turned upside down by a healthcare system that's failing them. These families face daily struggles that many of us can't even imagine. They are the silent sufferers, often overlooked in the grand scheme of things. Meet Sarah, a single mom diagnosed with cancer, who had to choose between paying for treatment or putting food on the table. Her story is one of many, highlighting the impossible choices people are forced to make. Sarah's resilience is inspiring, but it also underscores a broken system. Or John, a young entrepreneur whose dreams were shattered by a mountain of medical debt after a car accident. His ambition and drive were no match for the financial burden that followed his medical emergency. John's story is a stark reminder of how quickly life can change. These are just two faces in a sea of frustration. Each person has a unique story, but the common thread is a healthcare system that has let them down. The frustration is palpable, and the need for change is urgent. Their stories, filled with struggle, resilience, and a desperate hope for change, remind us that this is not just about numbers, it's about people's lives. These individuals show incredible strength in the face of adversity, and their hope for a better future is a powerful call to action. Their experiences beg the question, what kind of society allows its citizens to suffer like this? It's a question that demands an answer, and it's a challenge to all of us to do better. We must ask ourselves what kind of future we want to build. It's time to stop accepting the unacceptable and start demanding a healthcare system that prioritizes compassion and affordability. We need to come together as a community to push for the changes that are so desperately needed. Stay tuned as we explore potential solutions and empower ourselves to become agents of change. Together, we can make a difference and ensure that no one has to face these struggles alone. The journey towards a better healthcare system starts with us. Section 6. A Nation's Cry for Change. Across the nation, a chorus of voices is rising, demanding an end to healthcare injustice. From patients struggling to afford life-saving medications to doctors frustrated by bureaucratic hurdles, the message is clear. The system is broken, and we need change. The good news is that this isn't just a pipe dream. Across the country, innovative solutions are emerging. From grassroots movements advocating for universal health care to technological advancements promising to lower costs, there's a glimmer of hope on the horizon. Of course, politicians have been promising healthcare reform for decades, right? It's enough to make you cynical. But this time feels different. There's a renewed sense of urgency, a collective realization that we can't afford to wait any longer. In the next section, we'll delve deeper into these potential solutions and explore how each of us can play a role in shaping the future of healthcare. Section 7. Seeds of Hope. While the challenges facing the U.S. healthcare system are significant, they're not insurmountable. Across the country, innovative solutions are taking root, offering hope for a healthier and more equitable future. Take, for instance, the growing movement for universal healthcare, a system where everyone has access to quality care regardless of their ability to pay. It's an idea that's gaining traction, fueled by the belief that healthcare is a right, not a privilege. But it's not just about grand systemic overhauls. Smaller-scale innovations are also making a difference. Telemedicine, for example, is expanding access to care, particularly in rural areas. And price transparency tools are empowering patients to shop around for affordable services. These are just a few examples of the positive changes underway. Section 8. Raising Our Voices. The fight for healthcare reform is not a spectator sport. It requires each of us to raise our voices and demand better. We can't afford to be passive bystanders while millions suffer. So, what can you do to make a difference? First and foremost, educate yourself about the issues. Knowledge is power, and understanding the complexities of the healthcare system is the first step towards enacting meaningful change. Share what you learn with friends, family, and on social media. Next, contact your elected officials and let them know that healthcare reform is a priority for you. Support organizations fighting for affordable healthcare and consider donating your time or resources. Every action, no matter how small, contributes to the larger movement for change. Section 9. Beyond the system. While systemic change is crucial, it's equally important to prioritize our own health and well-being. After all, what good is a better healthcare system if we're not taking care of ourselves? This brings us to the next step in our journey towards a healthier future. For new moms out there, navigating the postpartum period can be particularly challenging. That's why I encourage you to check out our next piece, Workouts for New Moms Regain Strength Postpartum. It's packed with safe and effective exercises to help you regain your strength, boost your mood, and feel your best. Remember, taking care of our physical and mental health is an act of self-care, and it's essential for showing up as our best selves in the fight for a better healthcare system. Together, let's create a future where everyone has the opportunity to live a healthy and fulfilling life.